What happens during a full-body skin exam biopsy? Imagine walking into a dermatologist's office for a full-body skin check. The doctor begins by carefully inspecting every inch of your skin under bright light. They look at areas you might not think about often, like your scalp, between your toes, under your nails, and even your genital areas if you're comfortable. The goal is to find any spots or moles that look unusual. They pay close attention to changes in size, shape, color, or texture. They also check for asymmetry, irregular borders, or any evolving lesions. Sometimes, the dermatologist uses a special magnifying tool called a dermatoscope. This device helps them see details that aren't visible to the naked, making it easier to tell if a spot looks harmless or suspicious. If the dermatologist spots a lesion that looks concerning, they will decide if a biopsy is needed. This decision depends on how the spot looks, your medical history, and risk factors for skin cancer. Sometimes they might schedule the biopsy for another day if it's not urgent. When it's time for the biopsy, they clean the area with an antiseptic like alcohol to reduce the risk of infection. Then, they numb the skin with a local anesthetic, usually lidocaine. You might feel a quick sting or pressure during this step. To help with discomfort, some doctors may apply a topical numbing agent beforehand, especially if you're anxious. There are 3 main types of biopsies used during or after the exam. The first is a shave biopsy, where the doctor removes the top layers of skin with a small razor blade. Usually, stitches aren't needed for this. The second is a punch biopsy, which uses a circular blade to take a small, full-thickness round sample of skin. This often requires stitches to close the wound. The third is an excisional biopsy, where the entire lesion is cut out with a scalpel. This method is common for larger or deeper spots, and also usually involves stitches. After the biopsy, the doctor covers the area with a bandage and gives instructions on how to care for the wound. They'll tell you to keep it clean and dry. If stitches are used, they might dissolve on their own or need to be removed after a few days. The whole process typically takes about 10 to 15 minutes. Once the sample is collected, it is sent to a laboratory where a pathologist examines it under a microscope. This analysis helps determine if the lesion contains cancerous or precancerous cells. The dermatologist will contact you once the results are ready. If cancer or a precancerous condition is found, they will discuss the next steps for treatment or further testing. Remember, a full-body skin exam with a biopsy is a safe and minimally invasive way to catch skin issues early. It plays a vital role in protecting your skin health and catching skin cancer early when it is most treatable. Regular skin exams are especially important if you have risk factors like a history of sun exposure, many moles, or a family history of skin cancer. Always consult your healthcare provider for personalized advice and follow-up care.